Hello and welcome to the Anatomy Structure Identification series. Today we're going to be looking at the urinary system, and I will be dealing with two different models to identify all the structures today. One model shows all the organs of the system, the other will show the detailed structure of the kidney. There are two kidneys in the body. The kidneys are located behind the abdominal cavity and are said to be retroperitoneal. They are located slightly posteriorly at waist level. We turn the model around. Okay. This is the right kidney. This is the left kidney. I can tell that this is the front of the model because I can see the pubic symphysis in this model. Note that each kidney has an adrenal gland sitting on top of it. The adrenal gland secretes several hormones. The most recognizable is adrenaline. In this model, we can see the abdominal aorta from which the renal arteries arise. The renal arteries carry blood to the kidneys and enter at a region called the hilus. This is the hilus. The hilus is where all vessels and other structures enter and leave the kidney. The renal veins carry the blood from the kidneys to the inferior vena cava, and then the inferior vena cava returns the blood to the heart. The urine formed in the kidneys travels to the renal pelvis and then out by way of a ureter. Again, kidney, renal pelvis, ureter. Each kidney has a ureter that connects it to the urinary bladder. I'm going to turn the model so you can see that the ureters enter in the posterior region of the urinary bladder. I know this is a male because I see the seminal vesicles and the prostate gland. This is the urinary bladder. The urinary bladder holds the urine, and it is a hollow muscular sac that's collapsed when empty and can expand when it fills. It stretches as it fills, and there are nerve endings in the bladder called stretch receptors that monitor the amount of stretch and inform the brain when the bladder needs to be emptied. I'm going to open up the urinary bladder so that we can see. Here's the hollow organ, and we now see a tube leading from the bladder called the urethra. The urethra is a hollow muscular tube that leads from the urinary bladder to the external urethral meatus. This is a male model, and we do not have the penis on here, but the urethra travels through the penis and then out through the urethral meatus. It travels the length of the penis, thus making the urethra longer in the male than in the female. In the female, it is very short. This is why females experience bladder infections with more frequency than do males. It's easier for bacteria to travel up the short urethra in the female. And there are two sphincters associated with the urethra. The internal sphincter is involuntarily controlled, and it prevents leakage when the bladder is not emptying. The external sphincter is not shown on this model, but it's the one that becomes under voluntary control so that you can void when necessary. Now let's look at a more detailed version of the kidney. And the outermost region of the kidney is called the capsule. When a kidney is sectioned, we can see two distinct areas. The most superficial region is called the cortex. This is the cortex, and it's very granular appearing. This is where most of the nephron is located. The nephron is microscopic and cannot be seen here, but is the true functional unit of the kidney. This deeper region is darker and has cone-shaped structures. These cone-shaped structures are called the renal pyramids, and note how they look like a pyramid. They are located in this middle region called the medulla. Medulla means middle. They're located in the region of the medulla. The individual structures are called the pyramids. There are 5 to 11 pyramids per kidney. And we see that from the top of the pyramid to the capsule, that region is our cortex. We note that we have these striated appearance here, and that's due to the collecting tubules transferring the formed urine to these structures called the calyces. These are funnel-like structures that collect the urine and carry it to the renal pelvis. And this is a very nice view of the renal pelvis. Exiting the renal pelvis is the ureter again, and the ureter then would carry the urine to the urinary bladder. This concludes this section of the anatomy identification series.